Sculptra is a injectable, non-invasive way to enhance the volume in your face. It is trending lately, and there's a lot of controversy surrounding the use of Sculptra to enhance your face. I think it's a great option for those people who don't want to have surgery. They want a non-invasive approach, off-the-shelf option. And I'm going to explain to you today why and how to use Sculptra and why I think it fits in the whole paradigm of facial enhancement. So let me tell you why you may be getting facial atrophy. Either you have an age-related loss of fat in the face, you may have a family inherited disposition to getting fat atrophy. You might have had a facelift, which causes some peripheral fat atrophy, and sometimes even non-invasive procedures like microneedling that have been become more aggressive in terms of remodeling the face can cause facial atrophy and fat atrophy. So now the question is, how do we approach this fat atrophy and this hollowing, and what's the solution for it? Well, there's obviously several different ways to approach it. One is a surgical approach, which is like fat grafting, which is you can take fat from your belly, spin it down, and inject it in your face. That's one way, but that is a surgical procedure. Or you can consider Sculptra, which I think is ideal for this fat atrophy that occurs out in the perimeter of the face. Why do I like Sculptra out here versus, say, using hyaluronic acid injectables like Restylane, Juvederm, and et cetera out here? There are good reasons not to use those HA fillers out here because really and truly they have elasticity to them. So when you inject those HA fillers, it's very difficult to distribute those HA fillers over a broad area out here. Whereas Sculptra actually comes like a powder. It comes like a powder like this. And the powder is then mixed with sterile water, okay, and mixed with lidocaine. So when this is all diluted in a solution that allows the little particles in the Sculptra to be widely distributed underneath the skin. So I've been using Sculptra for many years, and I know where to inject it and where not to inject it. The ideal place to inject it, in my mind, is out here in the perimeter where there's large areas of hollow, loss of volume. Also, the temples, people lose volume in their temples, and that's a good place to inject the Sculptra deep in a deeper layer. And along the jawline is also a very good place to inject it. I never inject Sculptra around the mouth, however, or below the eyelid, and there's good reasons not to do that. Around the mouth, it's because our mouth is constantly moving, it actually will concentrate the Sculptra below the skin and lead to nodules around the mouth. So we don't want to put it in anywhere there's active muscle movements, particularly around the mouth. On the lower eyelid, because the skin is very thin, it's not ideal to inject under the skin, or on the forehead, or over the nose. I wouldn't inject in those locations either. I think the way it works is after it's been injected, it takes about a month before the body reacts to these little tiny particles that are placed under the skin. So it's not an immediate gratification like you get with, say, hyaluronic acid gel fillers like Juvederm or Restylane. It is not really a filler. It is a biostimulator. It stimulates the body to create collagen under the skin. Now, the second benefit of Sculptra is that it actually induces an improvement in the skin quality and tone and texture. So I see patients come back with improved quality of their skin, not only volume improvement, but also the skin improves. A question arises frequently amongst patients: how much Sculptra do I need to begin with? I believe in a very conservative approach in the beginning. I think you just need one vial in most cases, maybe two, depending on the degree of volume loss in the face. There are people who have on social media and in the literature have recommended anywhere from 2 to 6 vials of Sculptra to be used automatically in the first session. I don't believe that's necessary, and I think it's going to actually lead to more complications in terms of creating nodularity underneath the skin. The nodularity under the skin has to do with the dilution of the Sculptra. So the Sculptra comes in a powdered-like form like this, and it is then diluted with sterile water, and I dilute it to a great extent, and then I add lidocaine so that the injection is painless. And I only make a few entry points to fill in the areas that I want. I don't make multiple injectable ports on the face. That is unnecessary. You can use a cannula and reach most areas that need to be filled. After the Sculptra is injected, your face will look swollen and full. That's only temporary because it's been mixed with sterile water, and that will dissipate over a couple days. But the Sculptra will gradually stimulate the body to create collagen underneath the skin, and you start to see volume improvement in various areas. Now, again, that is not an immediate effect. It takes about 4 to 6 weeks before you see these effects. There's been some information, which I think is misinformation, that you have to re-inject the patient within 3 weeks following the first session. I think that's not giving the Sculptra enough time to react to create the beneficial effect that it has. Now, there are some downsides to Sculptra. Some of the downsides have to do with the fact that if you are planning on having a facelift, for instance, Sculptra creates underneath the skin little tiny scar tissue, actually. You may not feel the scar tissue, but it's actually creating these little pockets of collagen underneath the skin, which is associated with this scar. And if you're having a facelift, it makes the facelift surgery more difficult for the surgeon. The planes of dissection become a little more blurred because of these tiny little scars that are created by Sculptra. So if you're thinking of having a facelift either now or in the near future, I would say put off using Sculptra first. I would say that can be done secondarily. So if you have a facelift, for instance, and I've done this very recently with one of my patients who had a facelift, she ended up with some hollowing out in the perimeter of her face following the facelift, and that's not an uncommon side effect of having a facelift, which raises the skin flap and the fatty layer in the face. I then use Sculptra to stimulate the collagen underneath the skin and create more volume out there that improves the overall contour of the face. So I don't think Sculptra is a bad thing. I think it's a good option to consider when you're doing volume improvement and when you want volume improvement in the face. However, some people don't like it because it's not as predictable, say, as doing fat grafting or other procedures. First of all, I think it's safe. And second of all, I think that in the right hands, it is a predictable type of treatment. There may be some areas that don't take as well, which means that you can go back and augment the first treatment at some later time. But I wouldn't be overly aggressive right from the get-go by using too many vials of Sculptra to fill in the face. I think you have to be conservative because you don't know what kind of reaction the patient or you may get following this treatment. So I would recommend that you talk to the practitioner and say, let's be conservative, let's use one vial, split between both sides, and let's see how the Sculptra works. And I'll bet that in the majority of the cases, the Sculptra will do amazing things for volume replenishment as well as improve the skin quality of your face. So I believe in using Sculptra selectively. Now again, if you're going to have any filler around the mouth, then you have to use either hyaluronic acid gel fillers like Juvederm, Restylane, or some other brand. But around the perimeter of the face, where you have to be able to blend and smooth out the contour, Sculptra, because it's mixed with water, is a better choice. I hope I've answered most of the questions that you might have regarding Sculptra if you're considering having it. I think it's a good option for facial augmentation. However, if you have any questions, please leave them below. Please subscribe to my channel, and I look forward to seeing you in my next video.